There is a bark from West Africa that treated erectile dysfunction for 70 years, before Viagra existed. Clinical studies showed it worked in up to 75% of men who took it. The Food and Drug Administration approved it as a prescription medication in the 1930s. Doctors wrote millions of prescriptions. Pharmacies stocked it nationwide. It cost 6 cents per dose. Then, on March 27, 1998, Pfizer launched a blue pill that would generate $2 billion a year. Within 12 months, prescriptions for the bark stopped. The Food and Drug Administration began issuing warnings. The treatment that had worked for 3 generations became too dangerous to use. This is not a story about a plant that failed. This is a story about a plant that succeeded without permission, and about what happens when medicine that cannot be patented threatens medicine that can. Welcome to Nature's Lost Vault. The archive opens in the rainforests of Cameroon in 1896. A German botanist named Adolf Spiegel stands before a towering evergreen, 30 meters tall, its bark gray and bitter. The local people call it by many names: Ajajo, Jombe, Gabo. But the Yoruba have known its secret for generations. The bark holds power. Spiegel peels a strip from the trunk. He grinds it, extracts it, and isolates a crystalline alkaloid he names Yohimbine. After the tree itself, Pausinystalia yohimbe. What he does not know is that he has just discovered what will become America's first FDA-approved treatment for impotence, and what will later be erased to make room for profit. For thousands of years, West African tribes prepared the bark as medicine. They chewed it raw, macerated it in water, and brewed it as tea. Sometimes they added kola nut to amplify its effects. The elders knew. For a man who could not perform, who could not father children, who felt his vitality slipping, the bark restored what time had taken. Spanish explorers in the 1600s wrote of it with confusion. Missionaries called it pagan sorcery, but they could not deny what they witnessed. Men in their 50s fathering children, hunters traveling for days without exhaustion. The bark worked. It always worked. By 1900, European scientists turned their attention to the alkaloid. Spiegel had isolated. They tested it on animals first: rabbits, dogs. The results were undeniable: increased blood flow, heightened arousal, sustained function. In 1943, chemist Bernhard Wittkop proposed the correct molecular structure of yohimbine. 15 years later, Eugene van Tammelen synthesized it in the laboratory using 23 steps. But the natural bark was already in use. By the 1930s, yohimbine hydrochloride became an FDA-approved prescription medication for erectile dysfunction. Doctors prescribed it under brand names like Yocon, Aphrodine, and Yohimex. It was not a miracle, but it worked. Studies showed success rates between 34 and 75%, depending on the cause of dysfunction. For men with psychogenic impotence, vascular insufficiency, or diabetic complications, Yohimbine offered hope. The mechanism was elegant. Yohimbine blocks alpha-2 adrenergic receptors in the nervous system. This increases the release of norepinephrine and nitric oxide, dilating blood vessels in the corpus cavernosum. Blood flows in, blood stays in. Function returns. The pharmaceutical industry sold it for decades without fanfare. It was just medicine, effective, affordable, unpatented. Then everything changed. In the early 1990s, researchers at Pfizer were testing a compound called sildenafil for angina and high blood pressure. During clinical trials, male volunteers reported an unexpected side effect: penile erections. Sustained, powerful, reliable. Pfizer saw an opportunity. They pivoted. They patented sildenafil in 1996 and pushed it through FDA approval in just 2 years. Most drugs take a decade. Viagra took 24 months. On March 27, 1998, the United States Food and Drug Administration approved sildenafil citrate for the treatment of erectile dysfunction. The little blue pill launched with the force of a cultural revolution. In the first year alone, Viagra generated $1 billion in sales. By 2008, annual revenue hit $2 billion. It became one of the fastest-selling prescription drugs in history. Pfizer deployed one of the most successful advertising campaigns ever created. Erectile dysfunction, a condition that had been whispered about in shame, became a medical term discussed on primetime television. Men in their 30s and 40s, not just the elderly, were targeted. The market exploded. But something else happened in 1998. Something quieter. Yohimbine prescriptions plummeted. Doctors stopped recommending it. Pharmacies stopped stocking it. The FDA began issuing warnings. Not about the pharmaceutical-grade Yohimbine hydrochloride that had been prescribed safely for 70 years. About the unregulated supplements flooding the market. You see, once the prescription version vanished, demand shifted to the gray market. Unregulated manufacturers started selling raw yohimbe bark extract. Between 2000 and 2006, the California Poison Control System documented a sharp increase in adverse events linked to yohimbine herbal products. There were 238 cases over 7 years, and 134 required hospitalization. The FDA issued multiple warning letters to supplement manufacturers for false health claims and mislabeling. Studies found that dietary supplements labeled as containing yohimbe often contained wildly inconsistent amounts of yohimbine. Some had none at all. Others contained pharmaceutical-grade concentrations without disclosure. The narrative shifted. Yohimbe was no longer a traditional remedy with a 70-year pharmaceutical track record. It was dangerous, unregulated, unsafe. By 2019, Canada banned yohimbe products entirely. Australia, the Netherlands, and the United Kingdom followed. The Tennessee Poison Center warned in 2022 that yohimbine supplements could cause fatal cardiac events. But here is what they did not say. Pharmaceutical-grade yohimbine hydrochloride, the prescription medication, was never proven unsafe when used properly. The problem was not the alkaloid. The problem was that it could not be patented. It could not generate perpetual revenue. And it could not compete with a blue pill that cost $10 per dose, while yohimbine cost pennies. In 2000, a researcher named Dr. Alvaro Morales published a paper titled Yohimbine in Erectile Dysfunction. The facts. He wrote that yohimbine is an old drug. As such, it does not enjoy patent protection or commercial viability. Until molecular or formulation changes can be brought about, serious investigations of yohimbine will remain in limbo. He added that it could be that the naysayers are right. Yohimbine indeed lacks clinical activity. As long as it remains an orphan drug, we will never know. That is the truth buried beneath the warnings. Yohimbine worked, but it could not be owned. And what cannot be owned cannot be sold at scale. Viagra, with its 20-year patent protection, generated tens of billions in revenue. Yohimbe bark, growing wild in Cameroon and Gabon, generated nothing for pharmaceutical companies. So it was erased. But yohimbine was not the only casualty. Other plants suffered the same fate. Korean red ginseng, Panax ginseng, has been used for thousands of years in Asia. A 2008 meta-analysis of 7 randomized controlled trials showed that men treated with red ginseng were 2.4 times more likely to experience improvement in erectile function compared to placebo. The evidence was statistically significant, but red ginseng cannot be patented, so it remains a niche supplement, dismissed by mainstream medicine despite clinical proof. Horny goat weed, epimedium, contains icariin, a compound that functions as a PDE5 inhibitor, the same mechanism as Viagra. For 2,000 years, traditional Chinese medicine relied on it to enhance vitality and sexual function. Western science confirmed its activity. But icariin is a natural alkaloid. It cannot be owned, so it stays in the shadows. Maca root, Lepidium mayeni, from the high Andes of Peru, has been cultivated for 3,000 years. Incan warriors consumed it before battle. Modern studies show improved libido and sexual function. But maca is a root vegetable. It grows freely. It cannot be monopolized, so it is marketed as a superfood, not a medicine. The pattern repeats. Effective botanical remedies with centuries of traditional use and clinical evidence are systematically marginalized, not because they fail, because they succeed without generating profit. The yohimbe tree itself is now endangered. Cameroon was exporting 100 tons of bark annually by the year 2000. Harvesters strip the bark, killing the tree. The species Pausinystalia yohimbe is overexploited across its native range in Nigeria, Gabon, Congo, and Equatorial Guinea. Local people are paid 10 cents per pound for dried bark collected illegally. The tree that could have been cultivated, studied, and preserved is being destroyed. Not for medicine. For supplements of questionable quality that fill the void left by the pharmaceutical industry's abandonment. Here is what the FDA will not tell you. Yohimbine hydrochloride is still legal as a prescription medication, but most United States pharmaceutical manufacturers have discontinued production. Prescriptions are rare. Compounding pharmacies can still prepare it, but few doctors recommend it. The medical establishment has moved on. Viagra, Cialis, Levitra. PDE5 inhibitors dominate the market. They work. They are effective. But they cost $300 to $400 per month without insurance. Yohimbine, when it was widely available, cost 6 cents per dose. The question is not whether Viagra works. It does. The question is why a 70-year-old treatment with documented efficacy and a fraction of the cost was systematically erased from medical practice the moment a patentable alternative appeared. This is not about choosing sides. This is about understanding the economics of medicine. Pharmaceutical companies are not obligated to promote unpatentable compounds. But the FDA, an agency meant to protect public health, issued warnings about unregulated yohimbe supplements while allowing the pharmaceutical-grade prescription version to quietly disappear from the market. The result is clear. Men seeking natural alternatives turn to unregulated supplements. Those supplements are inconsistent, sometimes dangerous. The FDA points to the dangers as justification for the warnings. The cycle reinforces itself. The bark that worked for 70 years is now called Unsafe. The tree that fed indigenous knowledge for millennia is now endangered. And the blue pill, patented and profitable, became the only option most men will ever know. This knowledge is not lost. It is buried. Beneath regulatory warnings, beneath marketing campaigns, beneath the erasure of botanical medicine that refuses to generate quarterly earnings. The yohimbe tree still grows in the rainforests of Cameroon. The bark still holds the alkaloid that dilates vessels and restores function. The science has not changed, only the profit margin. If this vault opened something for you, subscribe to Nature's Lost Vault and hit the bell. Every like and every share preserves what they tried to erase. The next vault opens soon.